Hi, I'm Steve Bloom, practitioner, respiratory therapist, asthma educator, biophysiologist, and exercise. And today we are going to talk about your triggered response when you're having an asthma attack. So let's have a little asthma chat. So once you're exposed to what's going on in your airway, if you have, for me, if it's mold or mildew, dust, odors, something going on, we have an airway. And I have a great model here today for us that tells us what's going on. So within this, we have what's called, this is our normal airway. So in a normal airway, you can see that it's nice and open. We have our bronchial bands on the outside. Everything is nice and smooth and it's opened. Okay, so this is a nice normal airway. Now, our different medications that we use, obviously we have a maintenance medications that used to keep the inflammation and swelling away, but then we have a rescue inhaler that prevents the bronchial bands from squeezing down and getting that tightness. And then as well, we sometimes use mucolytics, or we use Singulair to help any kind of any allergic reaction that we might get. So right here with this first diagram here, we have a little bit of mucus or a little bit of inflammation there, mild inflammation swelling, but you can see the mucus that's building up in the airway. And for this, obviously, you might experience a lot of coughing, congestion. You might start to hear some wheezing, but then in our next one here, you'll notice that what it leads to is the inflammation and swelling in here. And if you could see really close there, it's starting to get more swollen in the inner area. The bronchial bands are not squeezing down yet, but there are three mechanisms here. Obviously, one is the inflammation and swelling, and then the bronchial bands that would squeeze down, and then also is that mucus that's in there. So when we get swelling like this, we start to use our maintenance medications that we're taking on, as not for rescue, but for maintenance. I'm not going to list them right now. You can go to our other videos and see all about the other maintenance medications that we're talking about. And also I have another video out there that's for triggers, what's your triggers response. But right here, we're showing you exactly what's happening. Now, this is when you have a severe swelling. The bronchial bands you can see on this image here are really squeezing down on the outside, the inflammation and swelling, and that's when we're reaching for our rescue inhaler. So your rescue inhaler, some people use albuterol, or isopropanol bromide, or Atrovent, but that's more of a muscle relaxant, but we're going for the albuterol here. And so you're getting that response here. And then your secondary is your inflammation and swelling, and then you have mucus production, and our goal is always to maintain a open airway there. So those are the mechanics of what's happening. So just to review really quickly, you have your mucus build up, or say you're irritated, say it's something hairspray, you walk through something with hairspray, you start to get a little coughing, maybe a little mucus builds up, then it gets more difficult to breathe. Some people go right into a response where they need the rescue inhaler, and the bronchial bands squeeze down and get tight, like here on this one. Sometimes people will get a response like a bang on the knee. Say you get banged on the knee, you get hit your knee, and we got to put ice on there. But we can't put ice on our lungs if we have inflammation or swelling. We use our steroid, which is our maintenance inhaler that has that in there. Sometimes we have to go to oral pills, and sometimes IV if you're really sick, going to the hospital. But that's for the inflammation and swelling, to make it easier to open up that airway. So once again, like us, thank you. I will see you in the next video. And if you want to reach out or talk to anyone here at Bloom Health, you're always welcome to do so. We get back as quick as possible. Thank you again. One breath, one step at a time.